Okay, got you. Right, good morning everybody and welcome to our Oversight and Engagement Board on the 14th of October 2021. I think we all know each other pretty well by now. I'm Councillor Matt Golby, Cabinet Member for Adult Social Care and Public Health. The Vice Chair of this group is Councillor Helen Harrison, who is the opposite number on North Hampshire Council. So welcome to our meeting today. We'll go straight to apologies. Cheryl, do we have any apologies to note? Can't hear.
Yes, I've got Councillor Julie Davenport, Councillor Gareth Eales, but Councillor Roberts is here, Councillor Jason Smithers, Danny Moody, Julie Shepherd and Toby Sanders, but Chris Pallow is here to give a vaccination update.
Okay. And if I may interject, Matt, apologies from Councillor Emily Fedorovich, and I'm here sitting in her stead.
Okay, thank you. Right, we'll move on to the minutes from the previous meeting on the 19th. They've been circulated. I did pick up one minor point, which was that it's got Councillor Emma Roberts down as being a North Hampshire councillor. She's a West, and I don't know if Emma saw that, but if we could just maybe alter that one for today as well. Is there any other points from any of the minutes that we're not covering in the meeting from anybody? Okay, so we'll accept those as pending that small minor change. We'll go straight to the action log, item 3. There was just one. I think all of the action log points have been completed. There was one point left from Helen. I don't know if that still needs to be followed up, or you got an update on that?
Yeah, I did follow that up with Lucy. Just to remind you, the issue was that the local MP had brought up with me and asked me to bring it to this group, that some local GPs had been contacting him because they were concerned that they had spare COVID vaccination and they didn't know what to do with it because the uptake, the supply was greater than the demand at that time. So by the time Lucy and I discussed it, the MP had already had a response, which was basically this was a national issue. I'm afraid that at that time, Chris Pallow may be able to tell us more, but at that time there was no particular action being taken on this. And the only, I suppose, thing I can say of comfort is that that MP hasn't continued to have GPs contacting him about that issue. So I hope that it's an issue that the supply and demand is roughly correct to those GP practices. But Chris Pallow may know more. But my understanding is that it's no longer a big issue.
Thank you, Helen. Chris, did you want to comment on that briefly?
Yeah, thanks, Councillor. So I think it depends which vaccine it was. There was certainly an awful lot more AstraZeneca within the system based on two things. Firstly, the race to get everyone vaccinated, and secondly, some of the publicity, the adverse publicity around that vaccine, meaning that there was more reluctance to receive that one than there was Pfizer. We were waiting for some time for collections to commence because we were really keen that the excess was collected and redistributed either within our country or hopefully to others that needed it. And there were some collections. So I think that issue has now gone away. And to be frank, the vast majority of stocks we now have in our county are Pfizer anyway. We have a small amount of AZ for those which need it or can't have one of the others, or which haven't commenced their programme of vaccination. But I think you're right, Councillor. I think largely that issue has passed us by now, gratefully.
Okay, thank you. So I don't think there's any further points on the action log we need to pick up. So we will move on to item 4, which is the Northampton Police update. Joel, do we have anybody from the police on the call at the moment?
And Simon is supposed to be joining, but he's not here yet. So
okay, well we'll perhaps come back to that then. Yeah. Okay, so we'll move on to item 5, the vaccination update, the winter and operational challenges and the social care staff vaccination. So we'll ask Chris if you can give the board a bit of an update, Chris. And
Thank you. Thank you, Councillor Golby. So of course, I'll give you a vaccination update. Just to be clear, I can't really do much on winter and operational challenges. We'll need that to come out in the round. So the figures I'm going to give you now, councillors, are those which were released nationally last Thursday. You probably will be familiar that each Thursday the figures come out. If we were chatting later in the day, I could give you the very latest. Really pleasingly, we've now vaccinated, well, we've delivered 1,022,000 vaccines in Northamptonshire. We hit the million mark 2 or 3 weeks ago, which was a massive milestone for us all. 531,000 our firsts, 491 our seconds. And of course, as you will know, and hopefully some of you will have been called, we're now in booster season, and we have delivered just shy of 40,000 booster vaccines so far through the programme. In terms of uptake, when you look at the various categories, the age categories that we have, for those over 40, in the 40s, we're over 85%, and for every other category 50 and over, we're around about 95% double jabbed. And of course, boosters are now coming through, with the majority of those receiving their boosters now in the 80s and health and social care workers. There's a growing amount, both in the 70 and 80-year-old population, who of course were called first, but we're starting to see that increase, which is pleasing. In terms of where we are on the broader programme, I'm just going to mention a couple of things, and of course, welcome questions at the end. So the first part is what we call the evergreen offer. That means, for whatever reason, if someone hasn't started their course or they've missed their second, whatever it might be, you can come forward. We're still giving first and second jabs to those who haven't come forward yet, irrespective of age. And the message we continue to give, because there are some areas of our county where uptake hasn't been as high as others, is forward. We have increasing number of local services for you, which I'll mention in a second. So the offer is there, the vaccine is there, the staff are there. Please come and give us your arms, and we will help with that. We are, of course, focusing on care homes. Care homes was a very important focus on the programme for first and second doses, and that is now underway, either delivered by local GPs or by a home visiting service. We have mapped every care home to a GP practice and ensured that we have cover there, and that process is now rolling out. It is slightly more administratively difficult than the first phase, because of course, in the first phase, we went into a care home, we gave everyone their first jabs, we went and gave everyone their seconds, and we're now at the stage where, of course, that population has changed. So some are ready and some are not, and that makes it just more administratively difficult for us. There's also a real push on those who are pregnant. We know that there are some more adverse reactions, and sadly there are some patients who are critically ill who are pregnant, and so we are maintaining, as is the rest of the country, a real focus on supporting people who are pregnant, to ensure that they're aware of the safety of the vaccine, the safety that brings to themselves, and of course to their unborn child. But that is a critically important message we are working hard to get over. What we are finding is that most people who have planned their pregnancy have planned their vaccination before conception, and many wish to wait for after they have delivered for the rest of their course. And the message we're giving in, it is safe to have it at any point, and actually it's really beneficial to do so. Our hospital hubs have reopened, so at Northampton General, at Kettering General, and our colleagues at NHFT to vaccinate with boosters and with flu all of our frontline care staff. Clearly, it's important to take care of our carers, and that is a programme that we're focusing on very heavily to ensure that our workforce are protected. And at the same time, we are inviting all those who work in broader health and social care, so particularly care homes, but also in social care, to come forward as well. And they can all book through the National Booking Service online or 119 and self-certify themselves within one of those caring roles. For the 16 and 17-year-olds, they can now book on the National Booking Service. We are above the national average for our uptake in that category, which is really pleasing. But as always, you'll hear me say, we don't rest on our laurels, and there are still patients to be vaccinated, and we'll ask them all to come forward. So how are we supporting greater uptake? We are starting our programme of pop-ups again. So next week we will undertake a pop-up in partnership with the Bangladeshi and Pakistani community, because that was really successful before. Our colleagues, one of Lucy's colleagues in public health, Dr. Annapurna Sen, is focusing very heavily on our inequality work and supporting additional clinics wherever we can around the county for some of our hard to reach areas. And we know, and we can drill down to district, borough, and on occasion street level to look at take. And we know that we have some challenging areas within the centre of Northampton and in Corby, it's been well publicised, where we can do some additional work. And we're focusing on doing that. But we have more opportunities now in the booster programme for patients to access local services. All of our GP primary care networks will be offering vaccination. We have more community pharmacies now. We had 11 before. We're around about 18 or 19 for the booster programme. The vaccination centre at Moore Park open, and as I've mentioned, our hospital hubs as well. So we have a number of offers available for people to come forward and receive their vaccine, and supply is not an issue. And finally, where your questions probably will be focused, and started with a bit of a preamble before we went live in the meeting, the 12 to 15-year-olds. So that programme started a couple of weeks ago. We've now visited 22 venues in our county, some large, some small educational establishments. And we've also invited all 725 homeschool children and those without a school place to be vaccinated as well. There is still a large journey for us to make, and we are ramping up that service, now visiting sometimes 3, sometimes 4 schools from next week in one go, depending on the numbers. Our colleagues who are running this service are the School Age Immunisation Service from Northamptonshire Healthcare Foundation Trust, who've done a wonderful job to get this service going alongside the traditional children's flu campaign and other things as well. We are seeing varying levels of uptake. Yesterday, I visited Spawn School, where 70% of eligible children had been consented by their parents. That's the highest we've had so far, and other schools are slightly lower. Others are lower still. The really important point to make about this programme is around consent from the parents, educational support for parents and children to have an informed discussion at home about the vaccine, where we hope, of course, they'll accept it, but we understand that that's a personal choice for everybody. We also know that there's a lot of absenteeism from school at the moment for very obvious reasons. And so we have a safety net in place for children who can't attend when the school age in service visit, or who decide after they've left that they might want the vaccine. We can't keep going back to each school. It's too much. We need to crack through this. So when that service leaves each school, the parents are informed how to access the vaccination centre at Moulton Park, so that there is a service that they can still come to. And we're seeing increasing numbers take up that offer. Children do need to wait for 28 days if they have tested positive before they come forward, but it's important that we ensure that that service is there. So before the start of half term, every school and every parent will have received information about the vaccine programme and when that's going to be coming to their school, and the programme is anticipated to be complete through every single school by mid-November. So that's the update, councillors, and as usual, I will gladly take questions.
Excellent. Thank you very much, Chris. Colleagues, are there any questions for Chris? Jim, you had your hand up. Was that because you had to nip off?
No, that was fine. That was because I had to eat my Weetabix. I support local industry, but my hand would be the same. Half term, presumably parents can, I think I picked that up right from Chris. So during the half term week, if people have missed out in some way or another, they can go to Moulton Park and catch up. I think I got that right.
So sort of, it wasn't half term, councillor. So what we currently are running, and we may increase it, we did have 2 clinics a week, we're now running 3 clinics a week at Moulton Park. When the school age service leaves a school, each parent receives a letter that says, this is how you contact the service at Moulton Park. They will be in touch and make an appointment for your child, and it will be into one of those 3 clinics. So they're running pretty much every week. Actually, it's not a half-term specific thing. So the half-term message was every school will have communicated to every parent the process for getting vaccination and when that's going to take place, so that parents know what's going to happen.
Thank you, Matt.
Thank you. Helen?
Thanks, Matt, and thanks, Chris, for a very comprehensive update. I think you covered almost all the things that I had been going to ask if they weren't covered, which is great. The one thing I did want to ask, and it's reported that some of these anti-vaccination groups are targeting schools with propaganda about the vaccination. Actually at schools. I don't know about in Northamptonshire, but in some places in the country, which to me it seems to be not only a terrible thing but a safeguarding issue as well. I just wanted to know if we've had any kind of experiences like that in Northamptonshire, and just sort of how strong the anti-vaccination community is in our area.
So I'm going to choose my words carefully, as we're obviously talking in public, but yes, we have. But blessedly at very small level compared to some other areas. So that's the first and important thing to say. Many schools on the first day of the programme nationally, and this was reported on the BBC, received a letter which was a fake consent letter, and that happened in Northamptonshire. We've had one small protest outside one of our schools that was there 1 minute and gone the next. And we have had some letters sent to a small number of governors at a school which basically said we would implore you not to do this. But I'd like to balance this off with, firstly, very small numbers compared to some other areas. No major disruption up to this point, blessedly. And as we are in public, what I would say is I welcome an open, transparent debate about the vaccination programme. I would not support any disruption or targeting of any individual, whether they work in a school or work for the health service, and certainly not children. A healthy debate is one thing. An open, honest, democratic society is absolutely what we all support, but nothing more serious than that. And I would also like to thank publicly Northamptonshire Police, who have provided us outstanding support throughout this entire programme, and have stood alongside us. And I'm extremely grateful to our colleagues for all of the care they've taken of us.
Thanks, Chris.
Excellent. Thank you, Chris. Are there any other questions direct to Chris? Okay, well, thank you very much, Chris. That's an excellent update as ever, and you've covered a lot of points, and we're obviously still doing exceptionally well in quite a few of those areas. So thank you very much, and keep up the good work.
Thank you, councillors. Have a good
Sorry,
meeting.
Councillor Golby, I did put my hand up. It was probably right at the last second. No, it was right at the last second. Just a very quick question for Chris, if that's okay. On the 12 to 15-year-olds, I'd heard that across the country, if a parental consent hadn't been given, but then the child consented to it within school, the vaccination was still happening. Is that how things are being run, or have I got that wrong?
No, you're right. So consent is a very, very tricky and contentious issue. So it is possible that it is possible in general terms that if a parent says no, but the child says yes, and they are competent to make that decision after a full assessment by the healthcare professional, that you can go ahead. What we are not doing is getting in between a parental decision and a child's decision. What we are doing is pointing that parent and child to have a more informed discussion and come to a dual response. And we're also really clear that what we don't want to do is get in between the parental relationship with the school, because that is somewhere we don't want to go either. So we're incredibly cautious about that. And the last thing we want to do is to cause any issues. So that's exactly what we're doing, is we are supporting parents and children to make a joint decision rather than inadvertently causing any issues, either within the family relationship or the parent to school relationship.
Okay, thank you. And I don't know if you gave it. Did we have a figure of uptake on 12 to 15-year-olds?
I
was scribbling away.
They're not public. They're not publicly published yet. So what I said was there was one school we visited yesterday that was 70%, but it varies underneath that.
Thank you. I thought you'd given a figure, but I'd scribbled and
it was 70 yesterday because it was a really good one.
Thank you very much. Appreciated. Really comprehensive. Thank you.
Thank you. So Lucy's got a point on this one to pick up the care home. Just a brief update on the care home vaccination situation, which I know has been a big deal for us, certainly as local authorities and nationally. There's been a lot of debate about this. But Lucy, are you able to offer just a bit of an update as to where we are, where we finished up?
Yeah, absolutely. So I've only got key statistics for the West, but obviously the North took a very similar approach. So both local authorities have been working really closely, obviously, with their workforce, because obviously they have directly employed adult social care workers, as well as those that they commission and contract through third-party providers. So they've been working both with the providers and with the internal staff really closely for a number of months now. Obviously, this is a process that went to consultation a number of months ago. And on the 22nd of July, after the government took the decision that this would be a requirement of anyone who went into into a care home to provide any form of care or service, that the 22nd of July was basically the beginning of a 16-week grace period. And during that time, obviously, that's when that engagement has happened, where we've worked with providers, our own staff, and we then made sure that there was an opportunity, working very closely with Chris, for those that had not had their vaccinations at all to obviously start to have those. And the deadline really for the first vaccination to have been received, in order to give an adequate gap for the second vaccination, for everybody to be fully protected by the cut-off date, and was the 16th of September. So obviously that was publicised for staff. Again, they were encouraged to ask questions, given information. My team were involved in focus groups, etc., with those staff as well. And by the 11th of November, all care workers must be fully vaccinated unless exempt. From a point of view of the current situation with regards to staff, there obviously are staff who still do not want that vaccination. As Chris says, it is, an absolute matter of choice, but we have been able to make sure that we address any misinformation that has been given. And obviously a lot of people were concerned because they'd heard things that actually weren't true. So we've been able to give them the correct information. And then what we've done is obviously work with both internal staff and our providers to make sure that we are offering the opportunity for all of those vaccinations to be administered. Bearing in mind there's nearly 4,000 staff that would be affected by this requirement just in the West, you can understand the scale of the engagement that needs to happen with staff and providers. But thankfully, we have ended up with high levels of vaccination. And the latest information that I have got at this point in time, certainly for our contracted care home staff, is that we had 450 had their first vaccination, but the second was outstanding. So that obviously was being pursued. And obviously of the agency care staff, we had 54 that had their first vaccination, with the second outstanding. So again, we're just making sure that we're understanding what barriers there may be to uptake so that we can facilitate the provision for those that do want that. Obviously, the council's taken a slightly different approach to whether they try to redeploy staff who choose not to have the vaccination within their own workforce or not. And obviously, if we want any further information, the Director of Adult Social Services will be able to give that. But obviously, our key ambition here is to, one, just obviously get as many of our general population vaccinated, but care workers obviously are vulnerable themselves because they come into contact with lots of people every day, but they work with vulnerable people as well. So providing them with all of the information for them to make an informed choice, and obviously support them through that process should they choose to go through it.
Thank you, Lucy. And I know in the West, as a cabinet group, we were getting regular updates in the run-up to some of the key dates here, and I think the feeling was we were quite satisfied that everything was being done to give that information and encourage people, and indeed those people that were still refusing to have the vaccination, that everything was being done to try and sort of redeploy them or help them out as best as possible.
Absolutely. And just to say, the North, as I said, unfortunately, David Watts, who's the Director of Adult Social Services, who would have been able to provide me with more recent numbers, is on annual leave this week. So apologies for that. We can always circulate that information when he's back.
Yeah, sure. Councillor Hakel.
Yes, it was just a quick point, and Helen Harrison might be able to answer that. When you say there is a regular update, as a backbench councillor in the north, I haven't seen any regular updates about how we might encourage, within our own wards, those staff to take up. Is that just a west thing, or is it in the north as well? Can it be shared?
I haven't been having any particular monthly updates in the north, in the same sort of formal setting that Councillor Golby is describing. Obviously, I talk to both Lucy and to David Watts on a regular basis about the issue to assure myself that everything is being done. And like Councillor Golby, I am assured that we are doing everything we can. Of our own directly employed care staff, our levels are high. There are a small number who haven't had the vaccination, but it is a very small number. So I wouldn't have, in the same sense that Councillor Golby has described to you, a sort of a formal monthly bulletin that I could put out, although I can discuss with Lucy and David if we have an appropriate, something appropriate that we can send out to councillors.
I just think that would be really useful, and what Councillor Golby was saying is the sort of information I think all councillors need.
Although I would say that I'm not convinced that it would be the right thing for ward councillors to be going around trying to persuade care workers in their patch to be getting the vaccination. I think that is something that's very much a role for our professionals. And obviously, as councillors, we don't deal with the everyday running of the council, just the direction. And I'd be very uncomfortable with ward councillors talking to care workers about getting vaccinations, because I don't think that's our role.
You've entirely misinterpreted what I've said. I just liked what Councillor Golby said, and it's not a question of running the council. I've been around for a few years, Helen. It's about when you come into contact with people, the opportunity to say, it's best to get these vaccinations. That was all I was saying. It just sounded like good information. Don't misinterpret me.
Fine, thank you.
Matt, you're on mute.
Sorry. Let's let Helen and Lucy pick that up perhaps after the meeting, and you can, let's work out whether there's anything that you need to circulate. Lucy, you did put your hand up there.
I was just going to say that obviously we've been working really closely with HR, with our health and safety executive sort of staff, and also obviously with the unions on this as well, Councillor Hakewill. So obviously the staff are getting information from a lot of different routes, because sometimes the unions are a more trusted route of information than perhaps the officers are. So obviously we are trying to make sure that we support them to get the information whichever route that they prefer.
Thank you, Lucy.
Thank you. We'll go to Emma next.
Thank you, and thanks for including the update, Lucy. Very much appreciated. You gave the numbers of uptake. We didn't get the numbers of that are remaining. Do we have that? I too, like Matt, have had updates, so I know where we were. But do we have something specific for today?
So those numbers I gave you are the ones that have had their first vaccination, but therefore the second is still outstanding.
Yeah,
so they're the ones, if you see what I mean, that we're obviously continuing to work with, because they have to have had both vaccinations at least 14 days before the cut-off date for them to be able to continue to work at that point. As I said, there are exclusions, and there's, as I said, there's been that sort of grace period while people are given the right information, but they're the numbers that are sort of outstanding, if that makes any sense. I don't have, with the information that I've had shared with me, those that have said they don't want either. I'm sure we could, as I said, particularly once David Watts is back as the DAS for the North, ask for both perhaps to come and give us an update.
Yeah, that would be great. I can pick that up directly with the director in the West as well, Lucy. Appreciated, because I get what you're saying about the cut-off date, but obviously I also appreciate the contents of the legislation, which doesn't rule out other alternatives and options for individuals, or for that period to be extended. And for something to be agreed around their employment. So I think it'd be good for us to understand that those numbers that have said no but are still employed, and what we're doing to try and deal with that particular aspect, given the loss and staff turnover within the care sector. So thank you.
Councillor Roberts, well, it's worth noting the councils have taken slightly different approaches on that as well. Yeah. But obviously this isn't just about adult social care workers. This applies to quite a wide workforce that obviously go to provide services within care homes as well, such as podiatrists, various others as well that you wouldn't usually think about. So it does have quite far-reaching implications.
No, appreciated. It would even include an officer that was going to deal with a CQC issue, and it would include a councillor that might visit, or even a union representative. So no, I do fully appreciate that. Thank you.
Okay, thank you. Jean next. Jean Addison.
Thank you, Matt. Lucy, can I just ask about schools? Because obviously there's been an increase in the number of infections within schools. And I know that the heads and everything are quite sort of demoralised after all the hard work that they did last year. And it just feels as if it's been like a pack of cards thrown in the air and pick up the pieces, really. What work are we doing to sort of try and to support people in education?
A huge amount. So there are a school lead in both North and West who obviously come to all of our weekly contain meetings, so they understand the context. Our challenge at the moment is obviously, so to try and describe this chronologically, when there was the ask of pupils to test twice in the week that they returned to school, what we picked up was obviously transmission that had happened in community. So one, there was trying to make everybody, the general public, understand that that was indicative of the fact that there are still high levels of COVID in the community. What we've then obviously subsequently seen is we've put lots and lots of very social, very tactile young people into very tight corridors, into classrooms and various other things, at the same time that the government obviously removed the requirement for household contacts to isolate. So we tested, we found high levels of community infection, which obviously some of whom were symptomatic, some of whom weren't, some of whom tested, some of whom didn't. Then we put them in an environment where it's quite likely to spread quite easily. So we then subsequently saw a greater increase in that age group. Meanwhile, they go home. Obviously, their whole families are exposed. And although there is still a recommendation for people to have a PCR test if they have a household member test positive, it is not an absolute requirement. And current DfE guidance also says that you can have your PCR test and then return to school until you have the test result. So if you are infectious, you could well be continuing to spread that. And so when you look at the epidemiological patterns, you can see we've got an increase in our 40 to 49-year-olds, which is the lion's share of parents. And then there's also significant epidemiological links between different school years where siblings have gone back into school, and potentially their PCR may have been negative. If they have it very early, your viral load isn't high enough for your PCR to come back positive. And if they don't do regular lateral flow testing, they could then subsequently turn positive later. The other thing we've also seen is obviously the links between two schools where you've got siblings, for example, in a primary school. So when you start to see the sort of epidemiological spread and how it just sort of blooms and through particular establishments and the links between families and other schools that siblings attend, it is a really challenging situation. Obviously, we're giving head teachers as much support as possible. We've had webinars with them where they can ask questions. Our challenges, as I said, the government requirements for isolation have changed significantly. So this is about personal choice, which is why I keep talking about just because you can do something, just because you can go back after you've had your PCR, doesn't mean you should. Our recommendation would be that you do wait and make sure that that PCR is negative. And I still personally would be recommending lateral flows on a daily basis if you've got a household contact for the 10 days that you would have traditionally, only a couple of months ago been isolating. But our challenge is we don't have the powers anymore to enforce any of this. So it is about trying to implore people to sort of use their common sense. They know what works. They know what the restrictions used to be and why. And therefore, if they've got some flexibility and their children's education, can be as little disrupted as possible, but still provide them with some regular testing, face covering wearing, etc. For us, we're imploring people just to sort of take those common sense steps.
Thank you, Lucy. I think the comments that I've received from teachers is, what was last year all about? You know, we've just thrown everything up. Okay.
I think there is a shared sense of frustration with head teachers, and indeed, to be honest, with the regional directors of public health, that you know, maybe some of these restrictions should have been relaxed after school term had started, so we sort of understood the lay of the land a little more. We're obviously hoping that people will take some very sensible steps over half term. They will use that as a little bit of a natural fire break, that they will continue to test, that they'll get that vaccination, and those that have been positive obviously do go, as Chris has suggested, to that vaccination centre when they get the call, when they're sort of 28 days after their positive diagnosis, so that we can start to really catch up, get that age group vaccinated. But also testing is going to be key here to make sure that people aren't, you know, unwittingly going into school and potentially spreading it.
Okay, colleagues, I'm conscious we've got quite a bit of agenda to go through, so if perhaps Jim and Emma could ask their questions together, we'll ask Lucy to wrap those two into one answer, if that's okay. Jim?
Two questions, and thank you, Matt. Firstly, with the lateral flow test, which I guess we've all been taking, is there any data or information on us doing it properly, if you like to say? You know, the rules are very strict about not touching your tongue and so on. That's question number one. Question number two is, last week, Kettering sat on Sky News in the middle of the screen as the highest in the country. Is there any explanation, when I say Kettering, I mean borough, any explanation for that, or is that just the ebb and flow of how this disease is moving? And now I think it's somewhere else up in the north. So two questions, and thank you.
Okay, Emma, did you want to bring yours in there?
Thanks, Matt. And I'll be very, very quick. For quick comment in that on this last oversight board, Lucy's words around viral load and being low at initial point of contact really resonated with me. And actually, I was positive on my last call and didn't know that because I'd had a negative PCR. But because of what Lucy said, I continued to test daily. So I wanted to encourage that because I then was quite poorly. So, yeah, thank you, because it really resonated. But then secondly, just on the school situation with mask wearing and the restrictions being all changed within schools, and there's a lot of, I'm trying to not make this political, a lot of lobbying of government at the moment to change that position and to bring things back. Are we taking any steps like that, Lucy, or is that something you can't get involved in at all?
So I'll take those in order. So testing methods or sort of accuracy of testing techniques does have an impact, Councillor Hakewell. We do know that if you have a professionally administered test, and that's why PCRs are still professionally administered, to make sure that we don't waste what is a much more expensive test. But we even know that professionally administered lateral flow device tests do tend to yield a more accurate result. Having said that, we have also managed to improve our testing ability. We have also, I think, just managed to train ourselves as well over time to do that more accurately, and therefore our concern about false negatives and positives, although lateral flows still aren't, you know, no test is perfect, they are better than they used to be, and I think we're seeing much better techniques so that there's fewer sort of false negatives and false positives. So that's good news.
Thank you.
Kettering, it's the same as to be honest, that we've seen in other areas. You see a correlation between low vaccine uptake, high deprivation, and then you know, community levels, and therefore moving into schools. As I said, schools are very often not really the specific place that the transmission occurs, although obviously, as I've said, they're not all designed brilliantly to space people out. So there clearly is going to be an increased rate in those kinds of areas. But you've got to remember that children and families are still mixing. You know, we are free now completely to mix. And Kettering, for example, when that had the spike, when we talked to people about where they'd been, there'd been a fair, there'd been a circus, there had been a number of inter-school sports events where numbers of schools, both locally and outside of the county, were involved. And again, it's about people, as I said, being sensible about just recognising that crowded spaces, mixing with different people that you're not usually in contact with, and a lack of testing, you know, is the perfect storm for onward transmission. So it's just making sure that people are sensible, are testing on a regular basis, even when they don't think they've been exposed. You don't know what you've touched, you don't know who you have come into contact with. So it is, you know, one of the things that we just need to make part of our routine.
Thank you.
Councillor Roberts, so yes, thank you for, you know, it is really important that regular testing is going to be the key going forward, and your example is perfect and very real. My challenge is I am an officer, I give advice to our councils, and I take their steer on the actions. So at this point in time, I'm in very regular contact with the chief executives and the leaders about are we wanting to put additional information out. And as I said, the other arm is we are also lobbying through the Association of Directors of Public Health, through UK Health Security Agency that used to be known as PHE, for DfE to review their guidance and really to recognise some of the challenges that we've got. So I've got a two-pronged attack, but obviously my responsibility is to give advice, and if the councils want me to take action, I then will.
Thank you, Lucy, appreciated.
Okay, thank you very much, everyone. Lucy, is there anything you wanted to pick up here on the winter and operational challenges, or is that something that we've either covered or you could pick up later?
I think it might be worth us having a session later on in the year, but I think the reason I say that is we have got a draft winter plan for the system. We draw one up every year. It's a requirement of NHS England. But obviously this year, again, it's going to be particularly pertinent because we've got flu coming back in. We've obviously got our flu vaccination programme. COVID is still very much with us. And obviously we've got the booster vaccination programme to try and deliver as well. So along with some of our staff challenges and the fact that we're a relatively small county with 2 small district general hospitals, you know, winter can be a real challenge here. So I think it is worth us, once that report is completed, bringing it back so that people can have a look at what our plans are to try and mitigate some of the pressures that we're already starting to feel.
Very good, thank you. Right, we'll skip back an item if that's okay, and ask Simon, or welcome Simon to the meeting, and ask if there's a brief update that Simon could give the board, please. Simon.
Yeah, thank you, Councillor, and apologies for being late. I will be brief. Firstly, thanks for the kind comments of Chris. I think he's gone now. But just to cover off some of the schools issue from policing point of view, we do get notified of the vaccine programme, which schools it's going into. Those are shared with our control room and they're shared with our local neighbourhood team. So should there be any issues, we know exactly where to go. As has already been said, we've had reports of 2 protests to date, both very low key with no real issues at all. And really, as far as sort of the COVID issues are concerned, that's been our main involvement now. We are not receiving any calls from the public at all now regarding COVID where they want any police intervention. As Lucy was saying, really, there's just very few enforcement powers now anyway. And for us in policing terms, it's very much business as usual. Our demand, both on the roads and for crime levels, violence, etc., is back to pre-pandemic levels, if not a little higher. Internally, just so you're aware, we always follow Lucy's advice. So we still are encouraging our staff to work from home. We have social distancing in the workplace, numbers in offices, double crewing. Hopefully you're seeing police officers wearing masks. We're extremely conscious that we don't want to lose staff because of outbreaks. And at the moment, we're also following the advice whereby if someone does test positive or they've got a child at home that's tested positive, we're asking that staff member to remain at home until they've had that test. Really, Councillor, that's just a very high level summary, if there's any questions.
Thank you very much, Simon. Any questions from colleagues to Simon? Okay. Oh, there we go. Helen.
Sorry, it always takes me ages to go to reactions, find my hand, put it up. I'm still pretty clunky. Yeah, just I don't know if you can actually answer this, Simon, but I'm just interested, given that you're continuing to follow really quite strict guidance amongst the police force to keep infections low. Are you able to comment? Are you able to comment on the success of that? You know, you probably can't compare with other organisations because you perhaps don't know. But do you think that your sickness rates or your absence rates from COVID are less as a result of the measures that you continue to take?
We think they are. We don't have any precise data, but what we seem to have shown is that particularly where someone's got a child at home that's tested positive, it doesn't seem to be unusual that within 2 or 3 days that officer is then also positive. And our concern is if we had allowed that officer to come back into the workplace for those 2 or 3 days waiting for the result, they could have infected, say, a team of 20 response officers, and then we have a real problem. So that's very much anecdotal rather than science. But that's our perception at the moment. But we are having that debate about how long we can carry on with that. But that's how we're managing it at the moment.
Yeah, it's really interesting, isn't it? It's sort of perhaps worth a study by somebody.
Yes, not a police officer.
No, no. Thanks, Simon.
Thank you.
Thank you. So I think you've got off reasonably well there, Simon. So
yes.
Well, thank you for your update and wish you well and your colleagues well. So
thank you very much.
So the next item is the weekly surveillance report, and Lucy has got this. I think the wrong papers were circulated, weren't they? And I did have a look through them and think some of that advice doesn't seem particularly current, but
yeah, so thank you and apologies. Yes, obviously this is the correct report. Now, obviously, as I always do, I caveat this with the fact that the data is out of date, so I can give you an update at the end. So I'll skip to the main points here and then just give you a bit of a view of this morning's data. In the week up to the 3rd of October, we had nearly 4,500 COVID positive tests in the county, which, you know, is extraordinarily high number. There had been a slight decrease from the previous 7 days, but obviously we're not really anywhere near as large as we need. And because of all the things we've talked about already, we know that that is school-aged children, in particular secondary school-aged children, and their parents, primarily aged 40 to 49. At that point, as I said, you know, Kettering was ranked as having the highest rate in England, and we talked about some of the exposures that we identified doing that contact tracing, which is so important to us to understand where people are getting infected and where we need to be providing support. Obviously, we know that vaccinations are being rolled out to 12 to 15-year-olds, and obviously I'll reiterate again that the fact that this is going to be one of the key ways of keeping not only our young people fit and healthy, but also reducing that risk of onward transmission that I've already talked about being very, very clear in our community. And obviously one of our concerns at the moment is that although we seem to be getting, according to today's data, slightly more on top of the 10 to 19-year-olds, we are still seeing an increase in over 60s. And that is going to be in part through some household and you know, community transmission where people are visiting older relatives, but also we've got that combined with those older people who will have had their vaccination first, and so whose immunity will be waning because they are coming up to being due their booster. Obviously, we're still unsure exactly how long that immunity lasts from the vaccination, but like we do with flu, we know certainly that boosters are required on a regular basis for viruses, and they obviously do have tiny little mutations, which mean that people become vulnerable to catching it, sometimes even twice, even if they've been vaccinated, but also even if they've had COVID, you can catch it again. So it is just making sure that people understand those risks and obviously do try and get that vaccination as soon as possible. If we just go to the first data page, Cheryl. So there's information in there about how to get hold of your information about vaccination, but you can see the pattern here, and we can obviously see the impact of returning to school and some of the activities that we talked about in the community. Now, as I said, we want to encourage people to be doing things. Absolutely, we know how difficult the last 18 months has been, but it's that regular testing, the vaccination and the face mask wearing when you're indoors and or in crowded spaces that's going to be key to keeping us safe over winter. But there is obviously a significant increase since mid-September, and that is that continued transmission and the impact of returning to schools. If we go on to the next slide. So again, you can see here, just compared to the England rate where we stand as a county, and we are the same as many places in the East Midlands, significantly higher. So that means that it's highly unlikely to have been by chance. This is the kind of the reality of our position. we have seen a reduction in the Kettering case rate since then, but obviously other areas just fluctuate as well. So we're by no means out of the woods. If we move on. So that obviously just gives a pictorial illustration. You can see Kettering starting to come down at that point, as well as Corby, which obviously is also suffered historically with that enduring transmission. But the point being that you can see that little dotted grey line at the very bottom, which is the England average. And, you know, we are markedly above that pretty much in all areas. So moving on. So if you look at the actual crude count of cases, as we've always talked about, this is to do with population density as well, but you can see there Kettering, even for its relative size, 887 cases in that week up to the 3rd of October was really quite an extraordinary event. As I said, we do know where the exposures were, we know where the outbreaks were that were primarily associated with education settings. And therefore we've been supporting all of those areas to make sure that parents are aware and pupils are aware of what risk mitigation actions they can take, but also just continuing to drive home those key messages about what we can do outside of the school setting too. If we move down. So this just demonstrates whether we're going obviously in a reducing trend or an increasing trend. So you can see obviously everything that's above the zero line is an increase as compared to the previous week. So that you know, starting to come down, but obviously what we need are blue bars below the line, which shows a decreasing trend. If we move on. So obviously demographically, girls and boys pretty much equal, which is good because it shows that we have got boys testing. We know historically that gentlemen don't always like testing as much as women. Women are much more proactive about managing their health. And this is a really, really much more balanced view, which is positive. And as I said, I don't want to discourage people from testing because, you know, I'm worried about the numbers. The more we test, as we know from Green Corps outbreaks and all those things, the more we test, the more we find and the more we isolate, the more likely we are to get back on top of things. But again, you can see, as I talked about, that familial trend where you've got that link with the 40 to 49-year-olds that are primarily parents and some in the 30 to 39-year-old age group as well. If we move on. So this is beds occupied, and this is starting to be the bit that I am keeping a very close eye on because, you know, to a great extent, we expected cases to go up as schools went back. We know, and I'm touching words, that on the most part, younger people who are infected either are asymptomatic, so don't even know it, or are, you know, have mild symptoms. Our challenge is the risk that they also pose to the wider community, and it's starting to be demonstrated here. We've got a 23% increase in our hospitalisations in the week up to, this is the 5th, that you can see the data goes up to the 5th here. So, you know, that is something that we are concerned about. I've talked about that growing trend in the over 60s, and I've talked about, therefore, you know, we're also seeing a number of small outbreaks identified in care homes, again, as we see staff and residents' vaccination immunity start to wane. So this, again, part of one of the reason why we need young people to be vaccinated is so that they can help protect those who are most vulnerable as we get round to that booster programme. If we move on. And of course, this is the other reason. So, you know, we have seen an increase in deaths in some areas, in particular the north, where our case rates are higher. You know, this still is a disease that for many, many people, you know, is fatal. And we never know quite who that will be. So again, we have to take personal responsibility to help protect each other. If we move on. So schools, I'll give you a bit more of an update. This was actually looking better. So it showed a total of 268 cases. We've had many, many more. And what we're finding is that school outbreaks, once you've identified a couple of cases, it snowballs really quite quickly. So as I said, that advice about face covering, wearing, regular testing, and if you're able to making sure that you have your PCR test before you return to school is key. But, you know, as Councillor Roberts has already alluded to, testing, doing those LFT tests, even after you've had your negative lateral PCR test is going to be key because sometimes your viral load isn't quite high enough at the point of the test to be picked up. If we move on, just do a quick outbreak picture, if that's okay, down towards the end. So here it just gives you an idea of what we're dealing with. So every area has got an outbreak. You can see, as I said, we've got more than we had in the last few weeks in care homes, but you can see here, although we've got 10 outbreaks in care homes, there's only 30 cases associated with that because they're testing twice a week. And because on the most part, those people are vaccinated, it's not spreading as quickly, it's not getting hold. So they're identified early and then those people are isolated and we're able to contain it much more easily. When you look at actually at this point in time, we only had 7 outbreaks in schools, but we had 437 cases. So, you know, once it goes, it really explodes within that kind of setting. As I said, you know, children are very, very social. And therefore, we just need to encourage those actions that we've got a little bit more influence over to try and keep them safe. So if we stop there, I'll just give you a really quick update from a point of view of the picture today. So the data from this morning is basically telling us the all age case rate for North and West Northamptonshire is still increasing. In fact, North Northamptonshire is increasing at a slower rate at 5.5% growth in the last 7 days, whereas West is 9.1%. Having said that, obviously North's case rate for all ages is 677.7, so we're still 5th on the Chief Medical Officer's watch list. West, not on the Chief Medical Officer's watch list, but as I said, greater growth in cases than the North is at 582.2 cases. And as I said, the good news is that we are starting to see a stagnation or even a slight reduction, particularly in the 11 to 16-year-old case rate, which is the secondary school age. We've seen a 9.2% reduction in the last 7 days in that age group in the North and a 2.7% increase in the West, so much smaller than we've seen in recent weeks. So that's good news and we need that trend to continue. What we have seen though, and it feels like, you know, what we get given but with one hand gets taken away with the other, is an increase in the 17 to 21-year-olds in both areas. 22.5% in the North, 69.1% in the West, and that is primarily to do, yes, with some school outbreaks again, but also university return, which obviously happened 3 to 4 weeks after schools returned. So, you know, these are the challenges that we've got, that constantly changing social interaction picture. And, you know, we'll start Christmas shopping soon, so I'm sure that we'll start to see outbreaks that are associated with people going out and having Christmas parties and also Christmas shopping exposures. So, as I said, it's about taking those sensible precautions when you're doing those things. But again, not an unexpected increase in that age group because of those reasons, but an increase all the same, and therefore, you know, an increased risk in general for the population. To give you an idea, as I said, you know, the East Midlands all-age case rate is 483. So ours being in the top 500s and 600s, you know, is a significant outlier. So there still is a huge amount of work for us to be doing. Our testing rates are good. They are pretty much, you know, they're definitely higher than the East Midlands average, and in the North they remain higher than the England average. The West is comparable to the England average, but that is going to be key, is that continued testing. As I said, the one bit that I am keeping an eye on is that increase in the over 60s, and that's gone up by 15.6% in the West and 13.5% in the North in the last 7 days. So, you know, that is the bit that I'm really concerned about, and it's one of the 4 tests for government to obviously keep us out of any kind of restrictions or lockdown, is making sure that obviously our hospitals don't become overwhelmed.
Okay, thank you, Lucy. Any questions to Lucy? We've got Helen and then Jim. Helen?
Thanks, Lucy. I put my hand up in advance this time, so I wasn't scrambling. Yeah, 2 questions for you, Lucy. One is, and of course, I caveat this straight away, I understand that just because somebody has had COVID doesn't mean they can't get it again. However, I just wondered, you know, given our high rates, are we getting to the point where, you know, our school age children are, you know, I don't know, a high percentage of them have now either had COVID and recovered and or, you know, had the vaccination. So I'm not trying to talk about herd immunity here. I know that that's not the right thing to do, but, you know, I've just wondered, you know, if because so many have now had it, we're getting to a tipping point where it's going to reduce naturally because so many have had it and have some immunity. And then my second question was, I saw on some of our latest data that we had received that the hospitalizations had been broken down by, we'd been given numbers on how many people in hospital have had 2 vaccinations, how many people in hospital have had only 1, and how many none. But there wasn't that data for deaths, and I just wondered if we had any data on deaths and vaccinations, because obviously the reassurance of knowing that those vaccinations are working is really quite important. And so I just wondered if there's any data about the deaths and vaccination status. Thanks.
So with regards to schools, I think obviously there will be an element of natural immunity, the same as there would be in the general population, but no, we're very far off of being anywhere near the kind of numbers that you would need for that even to be an option, which is something I wouldn't advocate anyway. But to give you an idea, for the county, for example, the overall number of cases in the last 7 days in the week up to the 12th of October was in schools was 1,972. Bearing in mind, for example, within the information that I've been given about the education settings with outbreaks, the one with the largest number was 160 cases. That's in a school of about 1,300 pupils. So, that you are not going to get any kind of herd immunity through this process. Vaccination is going to be what protects people. And, that there's just no other way of doing that is as safe as vaccination, recognising that there are risks with all vaccinations too. The point about double vaccination. So this is one of the things that I spoke to the UK Health Security Agency actually earlier this week about. So we are trying to find out exactly what data we've got on how many people are being hospitalised and how many deaths there are for people with no vaccination, single and double, as you say. Because obviously one of the things that we want to make sure of is that particularly in the younger age group, where they potentially haven't had their vaccination because they haven't either presented at all or haven't been double vaccinated, just understanding what the risk is for that younger age group. The data that UK Health Security Agency shared with me shows that actually, obviously, as we would expect, and we've seen that double vaccination does protect us to a very large extent. I haven't seen any data specifically around deaths, but I do have data I can share with you at a high level around admissions. But no, I haven't seen anything about deaths. What we do know, though, Councillor Harrison, is we've seen deaths fall significantly as there's a correlation as vaccinations have gone up. Yes, we do know that obviously the pre-vaccine, a lot of vulnerable people sadly died anyway. They weren't fortunate enough to have that opportunity provided to them. But at the same time, I know there will be evidence out there about the protection it gives from death, but I can see if I can find some if you're interested.
Yeah, that's great. Thanks, Lucy.
Thank you. Jim, next.
Thank you, Matt, and thank you again, Lucy. This may sound like a daft question, but the daft questions are always the good ones. When we have this data, for example, I've been taking lateral flow tests and others, thousands are. When I go onto the website and report that I've taken a negative test, where does the data come from? Is it the lateral flow? Is it those PCR tests? How do we compile the data? And how quickly does it come through? And I don't mind if that's something you wanted to come back to me on, but I just wondered how it's collated to give us the presentation we have today.
So we use a couple of different sources. We have something called NHS Foundry, which provides us with a lot of NHS related data, because obviously a lot of testing still happens within a secondary care setting, but primarily we use the same data sources as you do, because they have improved thankfully over time. So we use the openaccess.gov.uk data sources as well. I think we have access sometimes to layers below what the public can see, but we have the same data reporting timings therefore that you do as well. So a lot of the information that we give is publicly available on the .gov.uk website.
Thank you, Matt.
Thank you. Jean?
Thank you. Lucy, I think was mentioned earlier about pregnant women getting vaccinated. Do we know how many pregnant women have been hospitalised just recently?
No, I don't have that information. Not from a point of view of COVID. So again, the acutes would hold that information. Part of our challenge is that obviously as COVID legislation has lapsed, a lot of the data sharing permissions that came with that have also gone. So the acutes, as the care providers, would be the ones who would be able to provide information pertaining to that.
Thank you. Right, we will move on now to a brief update or presentation, I believe, on the contain framework, Lucy. Okay.
Yeah, so you've got some slides, we can bring them up, but it is really just to give a very brief update. So the contain framework is the government's sort of guidelines, if you like, for how we as a system should be sort of utilising the information and tools and the little legislation that we now do have still to basically contain the spread of the virus. Obviously, just please note, as I've mentioned before, that the UK Health Security Agency is the health protection part of Public Health England, and that's obviously been rebranded as Public Health England has been split up at the beginning of October. So if you see a reference to what's also called UXA, that is actually the UK Health Security Agency. So this was published on the 7th of October. It was sort of long awaited, and we obviously have been producing local outbreak management plans using the previous contain framework. So we were waiting to see really what the commitment was to testing and various other things over the winter period, and that's what this primarily contains. So as you can see, it very much focuses on the fact that the main line of defence is now vaccination rather than lockdown. So if we want to retain our freedoms, it's going to be vaccination and, in my view, testing as well that allows us to do that. It restates a lot of this is kind of re-emphasising the roles of each of the main players within the contain process. And again, it will be reviewed next spring once we've hopefully got through winter. And it really just does focus on confirming the efficacy of the current actions that we're undertaking rather than adding a huge amount that's new. So if we go on. So what it has done is confirm that PCRs and lateral flow device tests will remain free and that contact tracing will continue. Obviously, the government at that point didn't know whether it would be required throughout the winter period. They've now made that commitment, which is really good news. Targeted community testing will continue. And obviously, we've now got our mobile testing units, which go out and target particular communities. That's kind of groups of people, as well as geographic communities where either case rates are high or testing is low. And obviously we've talked about the correlation with that, with both admissions, but also the vaccination uptake as well. So we can provide an education service as we go round too. Some of the restrictions, but as I said, they're more about environmental health officer management of premises, for example, have been extended until March. And as we know, the flu vaccination programme has been extended again this year to include younger people as well as those 50 and above. So if you did have your flu vaccine as part of that extended programme last year, you will be offered that again this year, which is really good news. We do fully expect, just in case people hadn't worked this out, for flu to be really quite virulent this year because nobody will have been exposed really last year. So our natural immunity to any exposure, again, to colds and flu will have waned. I think everybody feels like they've got a super cold at the moment, that, those that don't have COVID and have got a virus, because I think our bodies, obviously have lost that natural immunity by usually we're constantly exposed to things. So, even just a sort of a cold that usually would be par for the course is knocking people off its feet. So flu vaccination again is going to be key to protecting us and the NHS services over the winter. So there are still continued test and trace support payments, and the local authorities have been given a small allocation to support people who aren't able to work and are not entitled to things like statutory sick pay, or if they need a crisis payment. So there still are some opportunities available to support people financially. And just to be clear, because of the change to the local authority public health regulations and powers, that a lot of powers now default back to historically where health protection responsibility sits. So the health and safety executive and the environmental health officers will now continue to lead on enforcing business related COVID compliance and enforcement, as I mentioned, in relation to those number 3 regs too. We just move on. So as I said, winter is always a challenge for the NHS and adult social care, and therefore they have provided, as they always do, a winter plan. And that is what we use to obviously help guide our local actions, but obviously they have to be very tailored to your local circumstances. I've mentioned before, we're an area with only 2 small district general hospitals. We don't have a big teaching hospital, so we do have to be very careful about how we utilise our resource, and all of our population need to play their part in that. But obviously one of the things that we talked about is very clearly communicating to the public the risk levels and the capacity within the system. And that's not just in relation to COVID, but it is in relation to all winter pressures. And obviously they've enforced things like the mandatory vaccine only certificate in certain settings, and the continued requirement for face coverings in high risk settings as well. So obviously this is focusing more on NHS services. If we go on. And then next step, so obviously it will refresh our local outbreak management plan in light of this. As I said, it reinforces a lot of the things that were already in place, as opposed to brings in anything significant or new. But obviously make sure that we look and review at what they're saying we should focus on, so that we know that our context is appropriate and our actions are focused. And then obviously look, as I said, at triangulating that the Plan B winter pressures planning work with our local winter plan development as well, which is why Councillor Golby suggested we bring that winter plan back at another point when it's been signed off. I'm happy to take any questions.
Thank you very much, Lucy. Any questions from colleagues? Jim?
Yes, 2 really. One is, in getting the lateral flow tests from a chemist, you now get a leaflet. You have to scan it with your mobile and go back with a code. I just really wanted to make the point, and it's a point we as councillors always make. Most of us are IT literate and have a phone that will do that. What happens to those people who don't? And it may be you don't have that knowledge, but previously you just go in and say, I need a pack of lateral flow tests, and it would be handed over. The second question, again, it may be out with, the Nightingale hospitals that were set up with quite a lot of publicity. When you say on your slide, unsustainable pressure on hospitals, are the Nightingale hospitals still out there, still equipped and still ready? And how would they work for Northamptonshire's 2 small hospitals if we did, sadly, get to an unsustainable level? Thank you.
Thank you, Councillor Hakewell. So lateral flows, you can just be given them. For people who aren't able to scan, you can just be given them. You can obviously, if you do have any problems with the test at all, dial 119 and get information about your technique, but also order more of them to be delivered to your house if you prefer not to have to go to the pharmacy. And obviously, again, if you have any issues reporting your results online, because again, that's one of the preferred sort of options that come with the pack when it talks about how to do the lateral flow, you can again dial 119 and report your information that way, and they will support you completely.
Thank you.
So there is always a get round clause. The Nightingale Hospital is a really good question. I haven't heard anything about them for some time, actually, Councillor Hakewell. Our challenge locally was that our closest one was Birmingham, and as much as they were, clearly a valuable resource for some areas, you have to provide them with the staff. And our challenge very much in winter was just as much about having the staff available to, to even support all of our local beds, let alone being able to deploy staff elsewhere. So I know the government have taken on some of those lessons learned, but I can try and find out for you, because I haven't heard about whether we'll be utilising those again this year.
Thank you, Lucy. Thank you, Matt.
Thank you. Okay, we'll move on, if we can, to the testing and contact tracing update. And Lucy again. I think we've probably covered most of it, haven't we? But
to be honest, we probably have. But I'll just sort of give you a quick run through. So we don't need to go through it all. People are very familiar with the information. If we go forward, though, Cheryl. So you know, we obviously have our local service. It is very busy at the moment, as I'm sure you can appreciate. They are still managing to maintain an 89% follow-up performance, which really, considering the number of cases we are receiving, is really quite extraordinary. We're obviously having to make sure that we continue to maintain staffing levels, because although we would, you know, we are hoping that that will go down, this is clearly going to be a feature now that the self-isolation requirements are lower. This is going to be a feature of our service going forward, is that high performance requirement. If we move on, you've got a breakdown of other areas and how we're performing in comparison, and our performance continues to be, well, actually at the moment it's the best, but it continues to, and we have done since the beginning, be around the joint first. If we move on, and actually, can I just say, I can't emphasize enough how important it is to engage in that process, because of the fact that we need to understand where people are going and what they're doing and where they're likely to have caught COVID if we stand any chance of making sure that we make those settings as safe as possible. So please do continue to engage. But you can see here, as I said, the numbers and how they've shot up in recent weeks, and how we expect that to be you know, relatively high across the winter for various reasons. So we will continue to obviously provide you with information, but this is in collaboration with the National Testing System and Service, who continue to do the initial contact tracing. We move on. So this is just a breakdown of whether people engage. Again, we've got a really good low rate of refused disclosure, but we would want to see it lower. And part of our challenge at the moment is that we're having to ask very busy parents to give us the contact tracing information for pupils because of their age. We're not obviously able to interview them. So please, parents, I appreciate how busy you are, but please do engage with us and be honest about where your children have been. Because as I said, unless we understand where the exposure and risks are, we can't support the system in mitigating those. If we move on. So that just gives you a definition of each of the breakdowns and why some people obviously are passed on to Public Health England, for example, because they're a complex case. So that, as I said, there is a collaboration here with the National Contact Tracing System as well. We move on. So for people with symptoms, we've still obviously got our PCR tests. So these are both the regional testing centre in Kettering, the local testing sites, which are static, and they're in Corby, Daventry, Kettering and Wellingborough. And then we've got the mobile testing units, which are these little pop-ups that we basically take around and are in place for about 5 days at a time. Again, you can see they're focusing on areas that either geographically need support and coverage, or indeed are areas where we know that there's high case rates or high footfall in usage, like the Still Park in Corby, for example. If we move on. Got some data there, just shows you fluctuation of testing uptake week on week. If we just go down to the lateral flow testing. So this is people without symptoms. Obviously, lots of different ways of getting hold of these, which Councillor Hakewell has already alluded to as well. You can pick them up from the asymptomatic testing sites if you want a home kit, but you can also pick them up from the pharmacies and all sorts of things as we've talked about. If we move on. So at the moment, we've got 2 asymptomatic testing sites, so Sessions House in Northampton and Swanspool in Wellingborough. And the reason we've only got 2 is because we've also got these mobile units, and we can obviously have home delivery and things with this test type, which we can't with the PCRs. If we move on. So this shows you where the door-to-door and the mobile testing units have been hanging out recently. Really, really good engagement when we're doing door-to-door knocking. And again, we're just focusing on areas that have got high case rates. Or as I said, where we've got low vaccine uptake, is one of the other ways that we can support people who don't want to have the vaccine, is to make sure that they are testing regularly. But it shows good engagement and good uptake. If we move forward. Again, this just shows of the community testing sites for lateral flow, what the uptake is like. Again, huge fluctuation, but they are all very useful. And obviously those that end up not being of use on a regular basis have been closed so that we can do that more targeted mobile testing. If we move on. So again, good rates. We want to maintain those, please. So please do engage. I want to keep that graph on an upward trend. And if we just go to the community pharmacies map, there we go. So that's, oh, back one. That's it. So still over 120 pharmacies where you can pick up these lateral flow device tests. As I said, a really, really good geographic coverage. But for those areas where I recognise that we don't have pharmacies, then you can still dial 119 or go online, and they will be delivered to your house within 24 hours. So please do feel free. I always have a couple of boxes at home, because if you do start to, you know, if you find out you've been exposed, doing those daily lateral flows is always best practice. So having a bit of a stockpile is always a good idea too. And I'll leave it there if that's okay. More information in those packs for people to look at in their own time.
Excellent, thank you, Lucy. And I'll just ask a very brief question as a busy parent, not as an elected member. My son tested positive with a lateral flow test on Tuesday. We went straight away to have a PCR test. My wife went separately. Her result came back yesterday. I haven't got mine yet, and I've spoken to different people that said, oh, mine came back within a few hours. Somebody said to me, well, I've had to wait nearly a week, and I appreciate that the system's probably overloaded, but what's the sort of general reasonable time you need to wait, if I could ask that?
Yeah, so the ambition of the service is to have all tests reviewed and reported within 48 hours. As you can recognise, because of the circumstances, there is quite a lot of demand. But certainly I wouldn't have expected it to be more than 72 hours, and you should be trying to dial 119 if you haven't had your report within 72 hours, just to try and make sure that it hasn't gone awry. Obviously, with the sheer volume of tests that are being transported around, sometimes these things do happen. And if you're concerned at all, as I've mentioned before, continue to do lateral flow daily, because that obviously, although they're not as sensitive, is still a good measure from a point of view of, are you likely to pose a risk to somebody else?
Thank you, Lucy. Jean?
Oh, sorry, two questions, Lucy. How well used now is the testing site at James Ashworth Square in Corby? And also about resources. While we're focusing on COVID, what about the other contactable diseases, and how has that been impacted on, you know, such as TB contacts and things?
Thank you. So Councillor Addison, all of the information about the site utilisation is in those slides. So if you have a look at those, if you've got any questions, then come back to me offline. From a point of view of infectious diseases in general, because obviously I'm responsible for all of the notifiable infectious disease management in Northamptonshire. It's been, as I'm sure you can appreciate, there's been quite a significant lull. So we have seen very, very few notifications of what are called notifiable infectious diseases, which are the ones that statutorily have to be reported by a medical officer. What we are seeing is that they're starting to go up, because obviously people aren't socially distancing. One of the things that we are seeing is DMV again, the norovirus, the dreaded norovirus, starting to pop back up in certain settings. So it is worth recognising that when you're also visiting care homes and healthcare settings, that is another pressure that we often see in the winter, and we want to avoid. And again, things like face mask wearing, frequent hand washing, and obviously not visiting if you've got any diarrhea or vomiting symptoms for at least 48 hours. You have to be clear of those symptoms for 48 hours before either children go back to school, if it's a young child, or a parent goes and visits any kind of vulnerable setting, an adult visits a vulnerable setting. Those things will help keep us in check. TB at the moment is not a significant pressure, thankfully, in Northamptonshire. We have seen a little bit of E. coli from a point of view of people going out and eating and picnics and things over the summer. That's kind of started to come back up again. But otherwise, the only other thing we've seen is Legionella. And that will be in part because lots and lots of premises haven't been flushing pipes because things have been closed. So again, it's an aerosolized respiratory virus, but it sits in stagnant water in pipes. And then when things like toilets are flushed or taps are run or showers are run, it's aerosolized and breathed in. And actually, interestingly, we've seen more than we would expect, not just locally, but regionally, actually, of Legionella. And that's simply because, people are starting to utilize those pipes again. So always do flush those things through with yourself out of the room if you ever happen to be using services that have been out of use for a while.
Thank you. Right, we'll move on to the last item, which is the communications updates. So I believe, Caroline, you're going to give this to us. Is Caroline there?
Yeah, I can hear you, Caroline, but you're quite quiet. Matt, can you not hear her?
No.
No. She's going to switch to a different device.
Okay.
Apologies, if we can just bear with her for a second. We had this, I think other people have suffered this kind of Zoom phantom thing that where for some reason, I think if someone has an update and somebody else doesn't, you can't hear them. So she's just swapping devices very quickly. And
the system's probably worn out. Right. So shall we, we'll just note while we're waiting that the next meeting is on the 9th of December at 9 o'clock. And I'm not sure, have we got any more all member sort of sessions on a COVID update booked in before the end of the year?
We have got one booked in November. I'll just try.
Hi, hopefully people can hear me now. I did preempt that happening, so apologies. One of the main things that we're using still as a communications tool, now we haven't got the press conferences, is the weekly surveillance report and press release. So that still regularly goes out on Fridays to our journalists, as well as the North and West website for the public. So that's a really good opportunity to get across the key messages each week. So last week, we urged parents to consent to children, the 12 to 15 age group, getting vaccinated. And also a couple of weeks ago, we picked up, as Lucy has mentioned earlier, the issues with the test and trace team and under 18s. So we used that press release to inform parents of what to expect when contacted. And that also was used within the system in North and West councils to highlight to parents that and to flag up those releases. So we do have ongoing engagement with our local and regional journalists, both proactively and as a reactive service. And there does remain a high media interest in COVID-related issues. For example, the high rates in Kettering, we have multiple inquiries, and also latterly about the schools. So the relationships with our journalists really are key in comms to our local population. And that's obviously proactive as well as reactive. And we're hoping that Laura from BBC Radio will be going out with a testing unit. Unfortunately, that's been put off for a couple of weeks because she's been a little poorly herself. And obviously, Lucy is regularly doing a Thursday pre-record. That's either used for the drive time programme or there's a circulation sort of fortnightly. Basically, it's either used for the drive time or the Friday morning breakfast. So we're also getting the messaging out there, which obviously is really important. We engage with the different media because obviously the print's useful because not everyone uses social media, and likewise the broadcast. So we're engaging with all our journalists and have good relationships with most of those, thankfully. Obviously, we're also using social media across our channels and working with system partners to get those communications out as much as possible.
Thank you, Caroline. Is there any questions to Caroline? No, I think overall communications, and we've mentioned it a lot of times, have been excellent, exemplary, I would say, in Northamptonshire since the very get-go. So your teams have done an excellent job. So if there are no further questions, we'll bring the meeting to an end. I hope that's been informative for everybody. We've got some good engagement, some excellent questions. And the next meeting is on the 9th of December at 9 AM. So without any further ado, we'll bid everybody a good day and thank you for your attendance.